Stroke in the brain is a devastating disease. So stroke in the brain happens when there is an occlusion of a blood vessel or there is a rupture of the blood vessel. Whenever there is a rupture of the blood vessel leading to a stroke in the brain, we call it as a hemorrhagic stroke. And whenever there is an occlusion of the blood vessel supplying to the brain or within inside the brain, we call it an ischemic stroke. So once there is an occlusion of a blood vessel, the blood being supplied distal to the occlusion is reduced dramatically. That's how the patient presents with a stroke. So if you look at 100 strokes, out of that 85% of the stroke is ischemic stroke because of an occlusion of the blood vessel. Rest 15% is because of a rupture of the blood vessel, that is called a hemorrhagic stroke. Now, as per the management of ischemic stroke, that is because of the lack of blood supply in the brain, there were several treatments. But of late, in 2015, there were 5 big international trials which has come up. They were published in New England Journal of Medicine, and that has shown that endovascular therapy is one of the best methods to treat these acute ischemic strokes. Before that, we used to give IV therapy, IV RTPA, which is a gold standard FDA approved treatment, which can be given up to 4.5 hours. So now the standard way of treating acute ischemic stroke is giving IV therapy SOS if required. That is, if there is a large vessel occlusion in the brain, we should move towards the endovascular therapy. So in endovascular therapy, we have 2 predominant type of treatment for acute ischemic stroke. One is called a stent retriever. We go inside the brain, we put a stent across the occluded segment in the thrombus, we allow the blood to pass to the distal segment, wait for 3 to 5 minutes, and then take the stent out. So the stent will hold the thrombus and take it out and open the blood vessel. That is called a stent retriever. And the other method is that you put a nice big lumen catheter which goes into the thrombus and you suck the thrombus. That is called thromboaspiration. So these 2 methods, which are approved now for treatment of acute ischemic stroke since 2015, has revolutionized the way we look at acute ischemic stroke and their outcome at 90 days MRS. And this is what we treat. Today we are going to show you basilar artery occlusion, which has come to us in emergency, and how do we treat that stroke. So once we got this patient with acute ischemic stroke with very poor GCS and intubated, we shifted the patient for a cerebral angiogram, and the angiogram demonstrated there is an occlusion of the basilar artery. Generally the basilar artery goes like this upward, and then it divides into SCA, supracerebral artery, and the posterior artery on either side, left and right. So everything is missing from the mid-basilar, and both ACA and both PC are missing out. So if you just look at such an angiogram, we are looking for a really poor outcome in this patient of stroke. And of course, we can see a critical stenosis on the left vertebral artery in the V4 intracranial segment. So we would try to approach from the right vertebral artery and go inside here and try to put a stent retriever like a Trevo solitaire, or we take aspiration catheter like a Cat 6 or Penumbra. We will see how things go. So we take a seat over here and just gently park, and then we go ahead and try to put a aspiration catheter or a stent retriever. So this is the lateral view, and which is again demonstrating us the basilar is missing, including bilateral PC and SCA. So we just quickly did a carotid angiogram to understand how is the PCOM, so that the support from the anterior circulation to the posterior circulation can be assessed. And this is the posterior communicating artery, and we don't see a lot of blood coming from the anterior circulation down. So it's very, very important that we open this basilar artery over here, otherwise the patient is going to get really, really sick. So we just checked with the anterior circulation here from the AP view, and not a good support, and either side of the carotid angiogram is demonstrating that this needs to be treated as soon as possible. Without a good PCOM on either side, and there is a basilar artery occlusion. So without wasting time, we just moved into the basilar artery, and we put our access catheter over here. We can just see that the basilar artery is badly missing, and hardly there is any flow into the posterior circulation, including the midbrain and the cerebellum. So now I have moved in with I'm deciding to go with a cat over here. We can see the distal end of the aspiration catheter. This is a 6F distal access 6F cat from Stryker Neurovascular, which has a very good trackability, and we can see it over here. This cat is over here in the mid-basilar segment, and we have aspirated the entire clot, and we just taken the entire clot out, and we can see that the entire basilar circulation looks fantastic. So here then I noticed that there is a critical stenosis over the basilar distal basilar segment just proximal to the SC origin. So I'm trying to cross with a wire, and I would try to park my wire somewhere in the distal PCA. Once that is done, then I will do a gentle angioplasty and then get rid of this problem over here. So this is my wire across. We can see there is a distal basilar artery stenosis, and then this is my balloon, and there is a little bit of movement of the roadmap. That's perfectly interluminal, and we have inflated our balloon, and now I'm quite comfortable. The patient stable, and this is the angiogram of the basilar artery after the angioplasty. We can see this is looking beautiful, and I'm quite satisfied to come out here. This is the final angiogram. So we came with a person who was occluded with the basilar artery over here in the proximal segment with the missing SCA and PCA. Now we have done a thromboaspiration, taken out all the clots, and we did a little bit of balloon angioplasty of the distal basilar segment, which was significantly narrowed, and now this looks so beautiful.